all eyes are on the figures, not just the number of cases, but pressures on our hospitals and the ages of people getting infected. That's all sort of taken into account when they decide where we're going to be in the categories. Well, Andrew Plant can update us now. Andrew, how's it looking?
Hi David, yeah, we had a good run of it, didn't we? I spent 4 weeks, give or take, standing up here saying that case rates had dropped pretty much across the board in the West Country. Unfortunately, that is no longer true. Today we've seen a rise in 14 of our 17 local authority areas, and as you've just been hearing, that is now most pronounced in Gloucestershire. Let's just show you a graph to illustrate that. The first part you'll see there is Gloucester, the city of. That first red bar shows you the peak of coronavirus rates there. That was about 4 weeks ago. The yellow bar shows you the low it got to last week, and then the orange bar shows you the numbers as of yesterday, a clear uptick in their case rates. Let's show you Stroud next, exactly the same pattern. The high 4 weeks ago, the low last week, and then an uptick in the latest data. Cheltenham, you've guessed it, exactly the same. High, give or take, 4 weeks ago, then the low last week, and again an uptick. And in the Forest of Dean, you'll see next, there was a high again 4 weeks ago, a low last week, but now there is a new peak. It's gone up higher than ever before. Now, it's not true across all of Gloucestershire, but clearly in some places there is a problem. So I spoke to Gloucestershire's Director of Public Health today and asked her what she thought was happening.
I think there are different reasons for the increases in different parts of Gloucestershire. For example, we know we have a couple of quite large outbreaks in care homes, which are driving some of the increases in places like Forest of Dean and Stroud, whereas there isn't in Gloucester City, for example, such a simple explanation. We think it's a bit more complicated.
Now, the rise is most pronounced in the Forest of Dean. We heard an explanation there for why that might be happening. Outbreaks in care homes, plus a fairly small population, but clearly something is going on there. We went there today to talk to people about what they thought about the latest coronavirus rates and about the restrictions they are currently under.
I am a bit worried about it, and I'm very worried about people all getting together over Christmas.
I don't think people took this lockdown so seriously as they did the first time. Well, that's just because they were fed up of it.
It's also a surprise because the forest is fairly sparsely populated, really. The population density isn't that big, so I'm quite surprised.
I think right at this moment in time now, for the country itself, they should just shut the lot completely right down. Much safer for everybody.
Let's run you through the latest figures today then. So, as you've probably already guessed, Gloucester's at the top. It's now up to 226 cases per 100,000 people, and the Forest of Dean now in second with 190. South Gloucestershire and North Somerset are 155 and 129. South Somerset and Stroud are 127 and 126. Sedgemoor is up to 120. The only place down at the moment is Bristol with 117 cases. Mendip Swindon are 116 and 115. Tewkesbury and Cheltenham 97 and 92. Somerset West and Taunton is 86. Bath and North East Somerset also down slightly actually to 82. Wiltshire is 76, that's up very slightly though. Cotswold also up to 60. And Dorset up to 44. So it is tier day tomorrow. They will get restructured possibly. The most important thing really was that hospital admissions kept going down and case rates kept falling. And unfortunately, in some places, at least here in the West, that is simply not happening.
We didn't want to hear that, Andrew. Thanks for that. Do be careful, won't you?